Hello and welcome to our presentation about the Hispanic population. We will be discussing the background, demographic data, health beliefs, and care of this population. So let's get started. So a little intro into the Hispanic background. So who are they? According to the U.S. Office of Management and Budget, a Hispanic person is defined as anyone who is Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish origin, regardless of race. You may also hear the term Mesoamerican, which is inclusive of Mexican and Central and South American origins. It should also be noted that Hispanic is an ethnicity and not a race. Many Hispanic people identify as multiple races. So let's talk about the Mexican background. Mexicans make up 63% of the Hispanic population, so it is important to look at specifically their background, especially since the United States shares a 2,000-mile-long border with Mexico. Even with security, the border remains easily crossed in both directions. Mexicans have been a part of the United States for a very long time, especially in the Santa Fe, New Mexico area at first. But now many settle in California, Arizona, Colorado, and Texas areas as well. The Midwest was also a popular place for Hispanics to migrate to become farm workers. Then they would eventually find permanent jobs to stay. This includes areas such as Michigan, Indiana, Ohio, Utah, and more, making this population very spread out throughout the United States. So, they have a variety of jobs, but many of them are not high paying or high status, such as management positions. Some of the jobs they do have include factory jobs, mines, construction, agricultural work, and service areas. Contrary to popular belief that Hispanics live in rural areas, many live in urban areas close to their field of work. Hispanics are also one of the ethnicities that have the highest rate of unemployment. And again, if they are employed, their wages are not very high, and that makes them fall below the national average of pay. Many Mexicans also failed to complete high school. However, in more recent years, we are beginning to see a change in this, and that they are encouraged to stay in high school and even go on to college, where they can eventually get higher paying jobs.
Hispanic demographics. The Hispanic demographic is both large and diverse, comprised of not one people but many. 62.1 million Hispanic peoples are living in the United States, which is roughly 18.9% of the population as of 2020. The Hispanic demographic is 61.6% Mexican, 9.6% Puerto Rican, 9.3% Central American, 6.4% South American, 5.8% other Hispanic or Latino, and 3.9% Cuban. This clearly displays that Hispanics are an ethnicity and not a race, showing how diverse they can be. Of those subgroups, as of 2019 census, 71.1% of Hispanics speak a language other than English in the house, with Central American families, 86.2% speaking a language other than English in the house. Economic demographics, 22.9% of Hispanics worked within service occupations, compared to the national average of 15%. 24.5% of Hispanics worked in managerial or professional occupations, compared to the national average of 42.8%. The median household income of Hispanics is $55,321, compared to the national average of $74,912. The unemployment rate of 10.4%, and a poverty rate of 17% in the Hispanic community, compared to the national average of 8.2 amongst other demographics. Health and insurance demographics. According to a 2020 Federal Census Bureau, projection, 2060 life expectancies at birth for Hispanics are 86 and a half years. Women living 88.2 years and men living 84.8 years on average. Um, Hispanic health is often shaped by factors such as language and cultural barriers, a lack of access to preventative care, and a lack of health insurance. Uh, the leading causes of death are cancer, heart disease, unintentional injuries, stroke, and other cerebrovascular diseases, diabetes, and Alzheimer's. Um, Hispanics have higher obesity rates than the average American. 49.9% of Hispanics have private health insurance. 35.9% of Hispanics have Medicaid or public health insurance, and 18.3% of the population has no health insurance. Um, Another disparity is low birth weight amongst infants. Educational demographics. Uh, Education has a high correlation with socioeconomic status and therefore insurance and general health. According to a 2020 Census Bureau, 71.8% of Hispanics had a high school diploma or higher. If we were to compare that to another demographic, such as white people, which maintain non-Hispanic whites, who are the majority of the population at 94.6%. 18.8% of the Hispanic population had a bachelor's degree in 2020, whereas 40.1% of non-Hispanic whites had a bachelor's degree. 5.7% had a graduate or an advanced degree, whereas 15.1% of non-Hispanic whites had a graduate or an advanced degree.
So, to move on from demographics and take a look at the traditional views of health and illness, um, there are kind of conflicting views as to what the meaning of health is for this population. One of those is the first one I have up there, which is that health is purely the result of good luck. And that kind of indicates that the person loses his or her health if that luck changes. Another belief is that health is a reward for good behavior. When people believe this, they are also saying that health is a gift from God and should not be taken for granted, meaning that they need to act in the correct way, eat the proper foods, and work for the right amount of time. As for illness, it is seen as an imbalance in the body or as punishment for doing something wrong. So, to go on a little bit more about how the body is imbalanced, the Hispanics believed that the body becomes ill when one of the four body humors are imbalanced. Um, the first humor is blood, which is hot and wet. The second is yellow bile, which is hot and dry. The third is phlegm, which is cold and wet. And the last is black bile, which is cold and dry. Um, when all four humors are balanced, the body is healthy, and when they are not, illness occurs. Remedy for the illness is based upon which humor is imbalanced. For example, when an illness happens due to the first or second humor and is hot, then the remedy is something cold. Or the opposite, if the illness comes from the third or fourth humor and is cold, the remedy is then something hot. This kind of becomes an issue um, because there is no clear definition of what is hot and what is cold. What may be hot to one person can be cold to another. There is also no clear definition of which diseases are hot and which foods are hot and which diseases and foods are cold. This is why it's really important to ask the patient that you're caring for, if they are Hispanic, what they can eat and what combinations of food that they think will be helpful to their condition. Um, if the healthcare provider understands the premise of the hot and cold and the imbalance, then they can understand better what the patient needs once they ask them. So, Hispanics also have several beliefs regarding, as they call it, dislocation of body parts. In reality, it's more kind of like specific illnesses rather than dislocation, but that's what the book used. Um, Empacho is one example where they believe it is caused by a ball of food clinging to the wall of the stomach, or the person lying about the amount of food they consumed. Um, with this, the person usually experiences stomach cramps or pain, and it's treated by rubbing the stomach and gently pinching the spine, along with prayer for treatment. Another more serious illness is Caída de la Molera, also known as fallen fontanelle. This occurs for children under a year who are dehydrated, and the anterior fontanelle becomes depressed, often due to diarrhea and vomiting, which makes them dehydrated. Many Hispanic people believe, however, that um, this fallen fontanelle can occur due to the physician or nurse touching the baby's head rather than just dehydration. But in reality, episodes of diarrhea are common in urban areas, and many children are often affected, and mortality rate is high due to folk treatment being found ineffective and not searching or not seeking hospital treatment. The Hispanics also believe in susto, which is a strong emotional state. It's an illness derived from fright. It affects many people, including male and females, rich and poor, rural dwellers, and urbanites. So, anybody from this population really can experience this. This state involves the loss of the person's soul that can occur while the person is dreaming or after a traumatic event. Symptoms the person experiences are restlessness, anorexia, disinterest in personal appearance when awake, loss of strength, depression, and introversion. So, kind of like staying inside, keeping to yourself. Um, it is usually treated with curandero, which is a healer, and we'll kind of get more into that in a little bit. And this person usually coaxes the soul back into the body. Another healthcare belief of the Hispanics is NVIDIA, which is envy. It's considered a cause of illness or bad luck. They believe that when someone is successful, their friends and peers will kind of become envious, and that envy places misfortune on the person that was successful. The book uses a great example of this. They said that a farmer finally becomes successful and can afford new clothes and equipment, but is suddenly struck with illness, and the farmer should place the blame on his friends for being envious of him.
So, aside from modern medicine, Hispanics have a lot of different methods of healing. Many times, the Mexican population um, uses magico religious practices, and these are practices that include making promises, visiting shrines, offering medals, and lighting candles, as well as offering prayer. They tend to use these practices when an illness is more severe. They make promises to God or to a saint in hopes of wellness in return. Saint offering is also very common in the Hispanic heritage. Some use the Virgin de San Juan del Valle in San Juan, Texas. People will make the offerings to her when they are in need of a healing miracle. Similarly, with Catholic Mexicans, it is very common to leave flowers and figurines as an offering for healing miracles. Offerings to saints relate to the pilgrimage as well when they are in need, and oftentimes Hispanics who live in the States will travel back to Mexico or to the San Juan statue in Texas to worship and leave the offerings to the statues of the saints. And then, like we had previously mentioned, the curanderismo is also known as folk healers. In what once was believed to be a healing practice by those who were poor, turned out to be a practice that was actually widely used throughout the entire Mexican population. Although not all of the population does believe in this healing, and it can cause some unwanted effects, like she had mentioned earlier about the dehydration. Folk healers are holistic healers, and those who seek their help are often searching for help related to social, physical, or psychosocial illnesses. Others use folk healers as well as modern medicine together. And then the most common type of healing is folk healing through tea and herbs. And then lastly, the parteras, also known as the midwives, have been used throughout the Hispanic heritage. They are thought to have the ability to heal. They are described as outgoing, warm, gentle, and cooperative. They give advice to pregnant mothers, and they also help treat any illnesses that they come across throughout their pregnancy, and then also guide them through the process of pregnancy and the birth. They do, however, do not care for mothers who are more at risk for an unsafe pregnancy. So, for example, if a pregnant woman is also having high blood pressure or is anemic, they will not care for them. And then for current healthcare problems and disparities, the current healthcare problems of Hispanics is correlated with socioeconomic status as well as their geographic location. The book says that the most important health issue for Hispanics currently is that the population is very young, but also has a high birth rate. Compared to all other races, Hispanics are seen to have a higher number of births in early teen or adult years, and this is contributing to a higher number of premature or underweight babies at birth and the crude death. Language barriers also contribute to the health problems with Hispanics. A clear example from the book illustrates how children have to act as the interpreter and translator for patients, which are often their parents, creating a difficult and emotional situation. Poverty commonly causes Hispanics to suffer from illnesses such as tuberculosis, malnutrition, cancer, diabetes, and lead poisoning. The large percentage of the population that lives below the federal poverty line is also much more likely to work in the places of occupational hazard, such as agriculture, which also puts them at risk for high risk in coming in contact with pesticides, which can also cause illnesses for them. In healthcare, patients are also urged to be punctual when they have appointments or meetings. And while having longer waiting times, Hispanic people tend to show up late to appointments or just not go at all so that they don't have to wait or waste their time. They value day and night and do not look at individual time as seriously as other cultures. Therefore, they are much more likely to attend minute clinics and walk-in appointments so they don't have to wait in line.
All right, so that concludes our presentation. Obviously, there's so much more about the Hispanic population that we could include, but this is just a brief look at everything that you could start to learn about to become more culturally competent in the care of a Hispanic person. If you have any questions or comments, please contact us or leave a comment under the discussion board. But I think that's everything. Thank you.